Welcome to Soul Body Wellness. And the conversation today is the ebbs and flow of menopause and the essence and overall wellness of a woman. And here today we have Dr.
Theresa Adeliyi.
She is not only an amazing, extraordinary doctor, trendsetting and just making waves in community and blessing so many lives by being one naturally who you are. You know, she holds back nothing. She's very honest with her clients, and I love that. With her is amazing. She's down to earth and very upfront and cares about the wholeness of a woman. So we have some questions, and we'll go through questions later. And so we're going to start talking a little bit about yourself.
Yeah. Thank you so much for the introduction. Thank you very much for inviting me for my first podcast. I'm very honored to be here, and I appreciate the awareness and the acknowledgement that I am very much passionate about women. So I am a board certified OBGYN. I have been practicing for almost a decade in a private practice. My mantra, my ethos is really understanding that women are the cornerstone of families and the community. So I am very passionate about caring for women, empowering women to really engage in their healthcare and just really be the cornerstone for their families. So that's professionally. I also have the awesome opportunity to teach our future OBGYN physicians to try to get them to understand the complexities of caring for women, but also care for them in the way that I feel like women deserve to be. Personally, I am a mom to a 19-year-old son. Yes, he is now a college student, freshman. Yeah. Brand new. So we're going through speaking of ebbs and flows of just being a new student. With challenges. My son is on the spectrum, so I'm so proud that he's in college and just doing it. As a woman, I am really working on the soul body wellness. You know, I'm just trying to balance everything, being a professional, being a mom, but also wanting to do some things for myself. So I enjoy traveling. I enjoy just doing exercise, and yoga is my thing. So like every woman, I'm really trying to balance it all, but also while having it all.
I love that. And more true to form, because you don't just talk. So that's we need more of that.
I try.
No, see, I always say we try our shoes, right? But we do life, because one way or another we arrive and we just.
That's true. That's true.
And that makes us so magical.
We are.
Yes, we are. I'm Rachel, your lifestyle coach. I've been doing life coaching. I don't know. I was younger than I am now, over 15 years, over 20 years. I work with herbs, tea, oils, and I believe in where they are. We do more than just talk therapy. I believe in engaging the physical wellness of a person to get those good energies going through. So a lot of times I work with clients and we do hiking, and then we do in lieu of that. So it's a very interesting profession to be in, and I love the uniqueness of what I'm creating. It's still in the making, and I look forward to grow and invite and be a part of all of your lives and your friends and friends and your friends and friends.
I like that.
Thank you. I too am a parent of two amazing young adult females, women who are courageous. Not really sure what happened to the camera right there, but something happened. Somebody's driving. Excuse me one moment, because this is just how we do in life, right?
That's right. Just roll with the flow.
Roll with the flow. Let's do. I'm working on the view, and that's not it. So let's see. Bertha, if you can put your camera off, that would be great. For a moment.
Oh, hey, Jackie, what's up, girl? I see you. All right now. Let's see. So we are having some tech issues right now. See, I did tell you about that. I'm not able to see the
We gotta roll with the
screen.
flow.
So,
It's okay.
yeah. There's Jackie. Follow host order. I don't know what that means, but we're gonna just,
Keep going.
all right, we'll just keep going because it's still recording. Oh, look at that.
There we go.
Hey. Oh, snap.
It's okay. Let's do it. Let's keep
All
going.
right, all right. We go with the flow because that's what parenting is. Anyway,
That's right.
Enlightenment. Okay, so in the essence of menopause, we understand the natural flow of it, right?
Right.
So most women, their menstrual cycle. Tell us a little bit about the stages that we start with, because we start somewhere,
Yep.
right? We start there.
So without really boring you all with all the technical and scientific detail, I will summarize a woman's menstrual cycle actually starts in the womb. As women, as female fetuses, we all are born with a finite number of follicles. Once we're born with whatever number we're going to have. And then when we reach our reproductive age, when we start menstruating, is when we start using up all those follicles. So in the middle of our cycle, when we talk about ovulation, that's because some of those follicles become eggs. We release them every month. If we don't get pregnant, we have a menstrual cycle, and then we do it all over again for between 30 years or so, depending on how early you start your menstrual cycle. And so the stages of that, by the time you get to 40, 49 years old, 50 years old, that is when the remainder of your eggs are either dying off or just no longer functional. And that's when we start entering the stage and phase of menopause.
Okay.
Yeah.
So the menopause stage ranges.
Mhm.
There are some women and then experience menopause at a point. That be considered a rarity, like in their 20s or early 30s.
Yes, if you are going through menopause at 20, 30, maybe even 40, early 40s, or premature ovarian failure. What that means is that for some reason, either your body is automatically like attacking your ovarian cells, so that therefore it accelerates the process of the follicles developing every month. And so you essentially use up all your eggs and follicles early. So that's a pathologic problem. So that's not normal. We don't really have good information as to why that happens. But we know that if a woman is having early menopause, is usually a medical issue going on, or maybe a genetic predisposition, because women tend to have menopause around the same age that women in their family enter menopause. So if your mom went into menopause at 45, the expectation is probably the same. If your mom went into menopause at 57, I've seen that. That means you're more likely to not get into menopause until 50.
Wow.
Yeah.
Okay. Still ticking.
Still ticking.
Riding brain.
The oldest I have seen of my patients is still menstruating at this time is 58.
Okay.
I can't believe it either. I've gotten blood work. She still has her hormones.
Wow.
Yeah.
God bless
I
her.
know.
That's
Every time I see her every year, I'm like, "Are you still bleeding?" Yes, and I start cracking up. Yeah. I feel bad. I feel bad.
Yeah, right.
It's just terrible.
That's a lifetime sentence for all of us. So many of us, like, who wants that? I
Yeah.
know my doctor thinks she's been laughing at me for a long time because I'm just like praying, like, come on, early menopause, be my friend.
Mhm.
And people are like, why would you want to go through that? I'm like, why would you not? Why would you
Yeah.
not?
No, I don't want that.
Yeah.
I mean, it's TMI, but I don't have periods right now, and I love it. So.
Right. But I'm not having my cycle right. Actually, I just had my very first one this past month, and I was like, what the heck? And I was just like, yeah, I don't miss it.
No,
I'm really okay with you leaving.
I'm okay with it.
Yeah.
I'm not doing that again.
But I want to say on a personal level, there is something that emotionally and spiritually connected that I was going through. Like,
Mhm.
I want everything. I want to die with everything I came into this world with. How
Yeah.
dare you take away my
Yeah.
opportunity to produce life? You know, a part of
I
me
understand that.
was like, oh, I don't
Yeah.
want that to go away, but I don't want to have a period like ever. Like, can we just
I mean, there's a happy medium.
Right.
I do have many patients who are ascribed to the same. I want to keep everything that I came in the world with. I'm also medically and scientifically oriented in my head, and my thing is like, if it's causing you problems, why are you trying to keep it?
Right.
You know what I mean?
Well, you fibroids, you're not planning on having any more kids. And I'm just like, but you know,
Yeah, if
what is?
it's causing you more problems than it's worth, then is it really okay?
Right, right.
That's how I see it.
Like chess. I mean, like dice.
I know, you're rolling the
You roll
dice,
the
man.
dice.
And I'm telling you, a lot more patients after there's any intervention that has been recommended, after they go through that, they're actually like more like remorseful. Like I really feel like I should have done whatever it is years ago because my quality of life would have been better.
Right.
And I think that's one of my what I try to really encourage women to really understand. But I think part of that is because we as physicians don't do a good job explaining options, explaining why we think a patient should do certain things. And so with the also my understanding of how women don't tend to believe or trust physicians in the first place, I can see why some of the conversations or recommendations may not be received in the way that is intended. You know what I mean? So
Yes. I've had my fair share of like, you know, it's like dating.
Yeah.
Like you date your doctor, you date your therapist.
Absolutely.
Everybody has an interview. We don't really know if we're a good match. You know,
Yeah.
I don't know how they like you.
Yeah.
You know, just gotta see where the vibe is at.
Exactly.
Yeah.
Yeah.
So you think about how freezing someone's eggs does it have any effect on them for the cycle of menopause?
So the short answer is no. The long answer is we don't have enough information to affirmatively say no. The process of freezing your eggs requires that we accelerate production of your follicles in a short period of time. So that's how we can harvest as many eggs, as many follicles as we can. I don't want to differentiate follicles versus eggs. If you think about regular eggs, like when you do egg over easy, yeah, yolk is the actual egg itself. The follicle will be like the clear thing around the egg, the yolk, right? And so the follicle is that when we ovulate, then we're releasing the yolk into your tubes where they get fertilized. That's the easiest way I can explain it. However, so the point is we're accelerating that process in a short period of time so that your eggs are turning over or follicles are turning over really quickly so they can harvest as many eggs.
Okay.
When you do that, we don't know what the long-term repercussions of, short-term accelerating division can cause.
Okay.
But I don't think what we do know is it does not necessarily accelerate your timing of menopause. I don't think it has any negative impact in terms of like increasing your risk of ovarian cancer or anything like that. Okay. Yeah. So we don't really have succinct information, but for the most part, in terms of all the negative possible conversations about that, we don't really have any evidence to support.
Thank you. That was detailed, and I know a lot of us don't often think about the design, the chemistry, the beautiful choreographed essence of what makes us close to us on a regular basis. Talk about the follicle, and around the egg, the yolk. We don't visualize that to understand. Each component goes through something.
Absolutely, and that's what that's why I love medicine. I just love the human body. It's just so well organized, and I just sound like a geek whenever I'm talking to patients. I have to remember they don't really care about the details, so I just have to kind of break it down that way. And I think it makes it easier for me because, like I said, my son is on the spectrum, and for years I had to figure out how to teach him because autistic children they learn differently. They're not necessarily like incapable of learning. You just have to figure out how to teach that. And so I think it made me a better teacher in trying to break things down.
Yeah. And I can relate, and so many of you can relate. We're still teaching our children, no matter how old they are, whether they're in adulthood or not. They've never been the age that they are.
Exactly.
We have, so it's our due diligence to love on them and teach them all along the way. And being a homeschool for a number of years, my youngest, well, both of them, it's very important to understand the nature of how they learn.
Yes.
So
Yeah.
And that was one of the biggest gifts
Mhm.
and brain twists that I am love because I became an advisor, which was great. So I can get to work with different kids, how their brains work, and like, oh, this works for you, but doesn't work for you.
Right.
Like I could just literally give one of them. You give her the book, and she's like, just give me the book. Don't give me directions. Don't tell me. Just give me the book.
I
And
can
for
figure it
me,
out. Yeah.
reading the index, I'm like, why do you want to do that? But okay.
That's how they learn.
And then just did the book, and I'm like, my job.
Exactly. It's
For
very
right now.
different. Everyone learns differently, and I think the typical standardized way of teaching students in the regular
Yes.
public school system is doing a disservice to our students who have a different way of receiving information.
Very true.
Yeah.
And that's another podcast.
Mhm.
So, are there tests that we can ask? Well, first, let me say, how do we have the conversation with our doctors about what type of tests to ask for based on our symptoms
Yeah.
or how we're feeling? If we don't have a name for it, we can't figure out what that
Okay.
is.
So since we're talking really more about menopause at this point, I think that in standard, there is no specific multiple tests that we can test for menopause. The only thing that is going on with menopause is your estrogen level is decreasing, and to some people, like undetectable level. That's literally what menopause means. Menopause is number one. Menopause is a phase, right? You're in a stage of menopause after you have gone 12 months without a menstrual cycle. That is your menopause now. But in terms of going to your doctor and asking for blood work, really the symptoms that we're talking about that we would get blood work for is, you're not having a period. Well, you're not supposed to be in the age of menopause, like you're 41 and you're not having periods regularly, or you're bleeding heavily, or you are having hair growth in different places. So we're thinking more like a PCOS picture, polycystic ovarian syndrome. So there are different symptoms like that would warrant blood work, so we can check what your hormone level is, and then we can determine what the intervention is. But to specific for menopause itself, really, we don't even check for blood work until we know that you haven't gone for however many months without a period, right? But women who've already had a hysterectomy, you're not going to have a period, so you wouldn't really know that you're menopausal. So the way that we can suggest that is when you start having symptoms like hot flashes, night sweats, all those things, then yes, we can get blood work to see what your estrogen level is. So that's really the limitation of trying to determine menopause. It really is clinically symptoms. If you don't have a uterus, then we can do blood work.
So, is there such thing as a hormone test that can capture what the different hormone levels are at that particular time?
It does, yeah. So there's estrogen, there's FSH, is follicle stimulating hormone. That is the hormone that your brain produces to tell your ovaries to work. And so if your ovaries are shutting down, which is perimenopause and menopause, your hormone that the ovaries are producing have decreased, right? And so your brain keeps beating on your ovary, produce more, produce more, produce more. And so the FSH level is high. So that's how we know that you're going to menopause, even if your estrogen level is not at the menopausal range at that moment in time. So that's why I say the utility of estrogen level when you're not fully menopausal is not really helpful. Because from day to day, you can have normal estrogen level today, tomorrow a little bit less, and that also coincides with the hot flushes that we get.
Okay.
So, the hot flushes and the night sweats that we get is usually, it can start 4 years before you actually get into menopause. So those times you can have normal levels of estrogen, which is why when women come to me and say, can I check my hormones? I'm having menopausal symptoms. I tell them it's not really useful because your hormones levels will still be normal until you really get to the point where you have no periods for 12 months.
So we're just in limbo.
Exactly. Yes, that's why your period plays around with you. Some women come to me and say, I don't have any period for like 3 months, and then like here comes flow. Right. I'm like, yes, it comes on, it goes away. You skip maybe 3, 4, 5 months. It comes back for 2 months. It gets lighter, so it kind of messes with you.
Yeah.
And that can happen for 2, 3 years before you actually go the 12 months without a period. Yeah.
Some of the side effects, or not necessarily side effects, but natural effects of starting to go through perimenopause that plays on the psyche, the mental, emotional wellness because of the ebbs and flow of the hormones.
Yeah. So the natural effects that we feel, like the signs and symptoms of menopause, they sometimes mimic depression. They also mimic thyroid problems. So when I say depression, you know, mood swings, irritability, feeling like everyone annoys you for like a small period of time, then it goes away. Obviously skipping periods, you can't sleep because you're having night sweats, so sleep disturbances. You do feel depressed sometimes, but it's not pervasive like a actual depression, major clinical depression. Yeah, so you have that, and in thyroid problems, especially low thyroid symptoms, you're gaining weight, you're having constipation, you're having more of like a systemic issue, right? So those are all. That's why a lot of women kind of misconstrue as something else is happening. That's why they want to check their hormones.
Yes.
What really is menopausal symptoms, perimenopausal symptoms. Vaginally, women experience dryness all the time, not just when they're having sex, and then when they are having sex is painful because it's dry, and then it's not as moisturized because you're not really having as good of a vaginal lubrication because the lining of the vagina is thinning, and so sex is essentially traumatic, and so some women experience bleeding after sex. So those are all the symptoms that women would have. Yeah.
So I can't blame it on my partner.
Yeah,
Like, yo,
sometimes.
you're just not doing the job right.
Well,
Like,
I mean,
I need you to do
wait.
better.
Well, doing better is the part where you have to emphasize foreplay, right?
Right. Yes.
That's the doing better part.
Okay,
Yeah.
yes,
Mhm.
yes.
Yeah.
Still, you might need some lubrication.
Yes. Yes.
What would you recommend for lubrication?
So for women who are just looking for homeopathic, like I don't want any medication, I think a lot of people underestimate the power of coconut oil. I tell women just get a small jar and put it by your bedside or in your bathroom. A small dollop in the vagina, just rub it around at night 3 times a week will keep the lubrication. Like at least keep the vagina moisturized, and then when you are having sex, you can use lubrication. I don't know if I can call it out, but it's in a purple bottle. I don't know if I'm able to say names. Can I say names on this?
I mean, it's freedom of speech, you know.
It's in a purple bottle, so Astroglide.
Well known. Yeah, it's in the grocery stores.
Well, coconut oil, and then Astroglide is in pharmacy stores. Yeah,
Okay.
yeah. So you can use those at the time of sex. Vitamin E gel cap sometimes also can help, and then we also obviously from that you can do medical management, which is depending on how severe the pain with sex is, the dryness is, and then there's options.
For lubricants, anyone who's looking for outside of coconut or looking to utilize a service that provides clean products, what would be the type of ingredients that they would look for, like water base or
Water base.
Okay.
Water base is better than alcohol at any point, and that's why Astroglide works better.
Okay.
Uber Lube is another one.
I remember Uber.
Yeah.
Okay.
Yeah.
From,
Yeah.
Yes,
Yeah.
I like that. I was like, okay.
It's good for vagina in the hair. Okay.
Yeah.
I didn't say that. I'm not funny.
Yes.
We all That's what they say.
Oh my.
That's what they say. That's what they say. Yeah. I know. It's Uber Lube. Yes.
Ooh, hey
Yeah. Not this one. This is natural. Why?
All right.
Next. We're gonna focus.
Next.
Yes.
Okay. So, sex. I mean, there are standard. I'm sure it still applies for women who are in menopause versus not, but how many sexual partners, making sure, like, how do you keep your health, your vaginal health, if whether you're with one person and there's trust issues, and or if you have more than one person. What are some maybe words of wisdom or things that you want to be wise about if your body is experiencing something? Like, what would you test for, or
in terms of like sexual health, in terms of like, avoiding STIs and things like that. So in general, as an OBGYN, I always emphasize condoms. I also understand some women say that condoms is very traumatic to their vaginal wall. It causes friction. They might be allergic.
Me?
Yeah. Okay. They might be allergic to it, and so
She said no.
There's a thing, there's actually female condoms. I think a lot of people are not really aware of that. In terms of just preparing your vaginal health, number one, knowing what's normal in terms of vaginal discharge is very important, right? If you're premenopausal, it is normal to have different consistencies of vaginal discharge. It can be creamy, thin, it can be pasty. It depends on where you are in your menstrual cycle for that.
What about color?
It's usually almost always clear, mucousy, or like thin white.
Okay.
Yellow, green, clumpy, that's not normal. That's
Okay.
more consistent. Clumpy is more consistent with yeast infection. Yellowish discharge can be just really, really bad yeast infection that has not gone away. Greenish discharge is almost always STD related. Gray type of discharge is more bacterial vaginosis, and that's the most common sexually transmitted infection, not necessarily an STD like chlamydia, gonorrhea. And so that is because of your vaginal pH, right?
Right.
So the likelihood of you getting infection or not getting infection depends on the balanced nature of your pH. Typically, acidic pH is better,
Right.
which is why women have that what looks like bleaching in their underwear. That's because your normal vaginal pH is.
Okay.
So for menopause women, it's more basic. That's why they tend to have more infection, right? Because their vaginal pH has changed. What can you do about to prepare that? Being healthy in terms of like, making sure you know what your sexual partner's STD status is, because that's going to help you whether or not especially if you're allergic to latex condoms, right? So if you know your partner is actually free, you can exactly. But I recommend boric acid to a lot of women.
Yes.
Because what that does is kind of maintains your pH. Get that anywhere online. It's a capsule. Usually you put it in the vagina. As a maintenance thing, just put it in one capsule every night for 7 nights, and then you can just do that every 2 or 3 months, depending on how off you feel like your pH is. What else to make it? And then, the coconut oil I mentioned. But really talking to your OBGYN provider, because a lot of women, they deal with these things not knowing it's not normal, right?
Right.
They come in and tell me I'm having vaginal pain, and I'm like, okay, so are you lubricated? Yeah, well, I'm wet. Well, I'm saying, well, how about if 5 minutes into it, do you get dry? Because then that also now is a function of your relationship, right? So if you're not really connected with your partner, it doesn't matter if you get wet the first 10 minutes. When you're having sex and your mind is somewhere else,
Right.
you're gonna dry up really fast.
Yes.
So preparation, pH, I would say, maintaining your pH balance, making sure your partner is, because I think that gives you a certain level of comfort and reassurance that if you don't use condoms, at least you're not getting anything.
Right.
Yeah.
What about vaginal vaginosis?
Bacterial vaginosis.
Yeah. Your partner can carry that. Right?
Correct. So what we don't do as a really good job in terms of healthcare providers is when you do have infection, right? We treat you with a medication, but what we don't tell you guys is make sure you're abstaining from intercourse for at least 10 days while you're taking the medication.
Okay.
Because what happens is the bacteria is in your partner's skin, and then if you're having sex within those times, it's transmitting it back to you. And so abstaining from intercourse, or at least with condoms, will prevent them from giving it back to you while the medication is in your system treating. Yeah.
And they can't, after you're done with their medication,
Mhm.
in fact, or
They-
could they be on
They
medication?
can. Well, they can. So the patients that I recommend for their partner to be treated as well are the ones that keeps coming back with infection.
Okay.
I treated you. You told me that you didn't have sex during your medication, whatever, while you were taking the medication, you were following the protocol, and you still kept getting infected, then yes, I would treat the partner.
Okay.
There are 2 other scenarios where you keep getting BV, your partner, right? So if your partner has other partners, your partner is introducing the bacteria from another person into your vagina. So now your vagina has to kind of get accustomed to a new one. A new infection flora, I should say. Women who are not having sex frequently, like if you hadn't had sex for 6 months and now you have a new partner, most women almost always would get BV in that vicinity of their new activity, because it's a new introduction of new bacteria from the partner into the vagina. Those are the situations where women can have BV, but it's not because of anything else.
Okay. Okay. That was very informative, because I know that it has been also a topic on social media about maintaining your pH and knowing your partner. So, I'm glad that we have that interaction.
then we have questions about myths, right?
Mhm.
What
Oh
was
boy, give it to me. I'm ready.
some
I'm
questions?
constantly dispelling myths, by the way. Like sometimes I spend like too much of my time, my 15-minute slot with patients dispelling myths that they found on Google. So let's go.
Right.
I'm ready.
So wait, we have one which is R.
Cindy, I'm driving. I'm ready. Let me see
All right,
ready. I'm ready.
One that we had only touched on. Are hot flashes, mini strokes, causing little nodules on the brain?
No. 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 No.
No.
No. I saw that. Thank you for sending me that clip. That's not a thing. It's really not mini strokes. I don't know where that came from, but I can explain how the hot flash is the center in your brain that regulates temperature. When you're menopausal, that regulation is very sensitive. So even the slightest changes in temperature will activate that area of your brain. That's why you get like flushing, your blood vessels dilate, the blood comes rushing to your face. And when you're also menopausal, everything is thinner. Your skin is thinner. You will notice that your vaginal, your labia, your lips, it's no longer as plump as it used to be. So that's why you sweat. That's the nature of the sweating that you get. The strokes that I don't know where that came from in terms of strokes that they talk about, but women, postmenopausal women, start having more cardiovascular issues when they get into menopause. Okay. So they have their risk of heart disease and things like that goes up when they get into menopause and matches men. So with all of those cardiovascular sequelae, right, it can increase your risk of like having mini stroke. It's not from the menopause. It's not from the menopause.
Are all your healthy eggs gone by age 30?
No. Like I said in the beginning, we're born with a definitive finite number of eggs. Over time, yes, you are losing those eggs through like maturation, ovulation. The rate at which you lose the eggs increases when you get to 35. That's why your fertility goes like this, and then you get to 35, boom, and it goes down.
Wow.
And so you lose a lot of your eggs by that time, but it doesn't go to zero.
Okay.
So which is why when they talk about advanced maternal age, AMA, I'm one of them if I were to get pregnant. That's what they talk about when they say your fertility decreases at 35 because a significant amount of eggs or follicles decrease.
And what are some reasons that a woman in their 40s are deterred from becoming pregnant, having babies?
But when you say deterred, are you saying like doctors are saying don't get pregnant?
Yeah, like it's like we come in for a visit, you talk about, hey, I haven't had any kids, or I did, and then we're talking about maybe having kids again, or oops, hey, by the way, I'm here and I am pregnant.
Okay. So I hope my colleagues are not overtly just saying don't get pregnant. The way that I approach women is saying that after 40, yes, that all the possible pregnancy associated like symptoms like preeclampsia, diabetes, preterm labor, all those things are accelerated and occur more frequently in women over 40.
Okay.
And so you are more at risk to have preterm delivery because you're having all those pregnancy issues earlier on in your pregnancy that requires a delivery earlier on. Mm-hmm. And so that's probably where that comes from. The women that I would expressly say don't get pregnant, and I say that in terms of like I'm going to give you all the information. Mm-hmm. This is my medical and obstetrical reason why I'm telling you this is not a good idea for you. Are the women who have heart disease, 3 or 4 New York Heart Disease Association classification. That basically means your heart is not working as well as it should be. So imagine getting pregnant and having your heart get worked even more. People that have lung issues, like the severe lung disease, people that have severe kidney disease, those are all the systems that really work harder when you're pregnant. So those are the patients I would specifically say, probably shouldn't get pregnant, but that's your choice. Right. If you're well aware of all the risks, I'm telling you that this is not a good option for you, and you get to make a decision.
Thank you. we had I have questions from people who had sent me a list of things. It's from like Joseph, who said, what are a few of the uncommonly talked about symptoms of menopause?
Yes, so there are. So women are surprised that the majority of women who have the hot flashes, night sweats, and they look like heat coming from your chest rising up, or heat from your feet rising up. Those are all the ways that women describe menopausal, perimenopausal symptoms. And hot flashes and night sweats. Those are like 70% of the symptoms, most common. But other times, women talk about like cloudiness in their brain. They can't really focus. They're essentially having ADHD symptoms where they can't focus. They talk about joint pain. They talk about their heart always racing. So that's more of like a general symptoms that they always maybe think it's something else, and it's not really menopause. What else? They might complain more of frequent UTIs because estrogen it supports not just the vaginal lining but also the bladder lining. So more women will start complaining of more frequent UTIs, or at least UTI symptoms. They may not have bacteria that's showing up, but they always have the symptoms of UTI, like frequent urination, maybe bloodiness in their urine and stuff like that. So those are not most commonly talked about. But those are the women that come to me and say, I can't focus, my job requires me to do multiple things at the same time. I'm finding that it's getting harder for me to do those things. So focus, a lot of women complain about that and are not aware that it's associated with menopause.
What about, is it frozen shoulder or something like that? That's what it's called. I have some women, their mothers have experienced
Like frozen neck?
neck or shoulder, like it's hard for them to move, but it was associated with menopause.
Well,
And now they're also experiencing it.
yes,
I don't know.
that might go with the joint pain and joint problems that I was talking about, but it's not very common. Sometimes it might just be mediated by other reasons, but yeah.
What about women who have had like a hysterectomy and or a partial? How does menopause affect them?
Well, when women say partial hysterectomy, that basically means that we left your ovaries. At least that's what we think as medical people. And so if you had a hysterectomy, which means your uterus was removed, but we left your ovaries, nothing changes in how the menopause symptoms is, because your ovaries are the ones that's causing you to be menopausal anyway, because that's where the hormones come from.
Correct.
They still experience the same, with the exception of they don't know that they're getting into menopause, especially if it's happening at like 45, right?
Right.
They're not having a period, so they don't know it's menopause, so they think it's something else. But yeah, there's not significant. It does help with what we recommend for medical management of menopause symptoms.
Right.
Yeah.
Thank you. What about homeopathic? I'm gonna get up. I don't know if the camera is recording me, but
Yeah, it's catching us.
Oh, it is.
Yeah.
Oh, okay. Yeah. Some things and talk
We're good.
time like
Let it
housekeeping,
be.
because we just do that.
Let it be.
Okay.
Yeah.
So, herbal remedies. What herbal remedy do you recommend for the common one, which is hot flashes?
Yeah.
And what you would recommend, is it a dual component that would help with what you talked about, like having ADHD, moments your brain's hard to focus, or would that be something else?
So that would be something else. So the herbal remedies that are available, it's important to understand that those really only address what we call mild symptoms.
Okay.
So the mild symptoms, what we classify as mild, is you're having hot flashes maybe every day, but maybe once a day or maybe twice a day, and that happens not significantly. It doesn't interrupt your day. You're not like crying. You're not like, it's not intrusive. That
Right.
herbal remedies will probably work for that.
Okay.
And the ones that I recommend, there's the Dong Gong Kwai. I'm not saying it very well, but that's been proven. It's like a Chinese herbal remedy. Black cohosh has been discussed. What else? St. John's wort.
Yeah.
So those are herbal remedies that we hear the women say that helps them. However, there's no formal like testing that says this actually works. So we just believe it's just by hearsay.
Okay.
It would not address the cloudiness or like the focus issue. It wouldn't really do that, because those are more moderate to severe symptoms.
Right.
And so I think mostly it would be like hormonal or non-hormonal options, medication options, best option for that.
And diet and exercise would definitely.
Diet. Thank you for reminding me. Diet is a good soy product,
Right.
soy-based foods, because they have like estrogen activity component that helps, decreases the effects of the hot flashes. So soy foods like soybeans, hummus, those are all soy products. Exercise. It hasn't actually been proven that exercise will decrease hot flashes.
Okay.
That's not to say don't exercise, but if you're exercising with the intention of hot flash reduction, it does not. But definitely for cardiovascular health, absolutely. Wearing layered clothes is actually really helpful. Keeping cool temperature, ambient temperature all the time, maybe like 67, something that's ambient to you. Because remember I said that the temperature regulating center in your brain is very sensitive to changes in temperature. So if you keep it the same all the time, hopefully this fluctuation will be less.
Makes sense. Makes
Mhm.
sense. I'm not there yet. Okay with that. I'm gonna go briefly into acknowledging herbal remedies, oils and teas. And I welcome your feedback on
Okay.
any.
Okay.
So for some of you who have been part of the community and working with me, I mentioned there was a part 1 series for menopause. And so as you know, excuse my alarm, because I have an alarm for an alarm, and those who know me know me. It ain't happening unless I have an alarm. So back to the book. I've been using the essential oil hormone solution by Dr. Marissa Schneider. I've been studying it because I am an herbalist at heart, and I'm still pursuing that avenue, and also using another line of literature from her, which is the essential oils for menopause solutions. I have a girlfriend who made some solutions for me and for someone else who is having some severe cramping. Or so through my trial and errors in life, the ebbs and flow of being an herbalist at heart. Black cohosh.
Kohash. Well, I don't know if I said it right, but that's how I say it. Yeah.
It is a weed plant, so I want to say herbal medicine is truly a medicine. It's really important that you just don't take it lightly.
Yeah.
That you just don't think, oh,
It's from the earth.
It's from the earth. It's natural. It's okay. I can take it. It is true the first medicine, and it's valuable that you speak with a professional, because there are components that you should not be mixing with others, and that also means if you are taking over medications, and or other homeopathic remedies, supplements, and things of that sort. And
anything benign can be bad at high doses.
Yes. So for one, Black cohosh has been a traditional medicine that has been used by North American indigenous tribes, which was adopted by Chinese medicine, which has been used for a variety of things, not just to help with hot flashes. One of those things, it also helps with this arthritis, does help with the menstruation, premenstrual syndrome, musculoskeletal pain spasms, support liver function. And again, these are just things that people have experienced. It doesn't mean that this would apply to you. Right. Everyone is different. Everybody has a different response. For an example, I am allergic to weeds. That meant that I was no longer allowed to eat watermelon. Yes, I said it, watermelon. Or honeydew, or whatever. A lot of people don't know that honeydew and cantaloupe are related to weeds. So if you have a sensitivity to that, you really need to be aware, knowledgeable of how that might affect you, and then again, speaking again to a professional. However, I do use a variety of teas like clove and I have a blank right now, but I'm okay with that. And not clover, but clove from the clover plant. That is a spice. I use that. It does help with intensity sometimes with PMSing. It also is good for your skin. I've done well with that. in the essence of working through teas and oils, I try to match them based on my symptoms. So if I am using a tea, I also believe in ingesting the oils. And you want to make sure they are clean oils, make sure you have a good service that provides that for you. So for an example, like if you're going to make oh, just so you all know, we are going to go over. I understand if we have to drop off, it's okay. We will be posting this in the podcast room for Soul Body Wellness, and I'll let you all know when it's up and running, give you a heads up. But I do understand if we have to go, because I did say it's from 12 to 1. However, I did schedule the meeting to go over because we just are talking about very important things, and sometimes it just goes a little bit longer. I appreciate your patience and support. So in the essence of talking about herbal herbs, oils, and teas, if you're going to mix an oil, a substance, an oil like lavender, you're going to want to make sure that you have a carrier oil, and that carrier oil can be fractionated coconut oil, cold pressed coconut oil. The difference, cold pressed would be solid and hard, where the fraction coconut oil will be like temperature, more liquidy, more accessible, easy. Then there's jojoba oil, grapeseed oil for those who have rosacea, and grapeseed oil, sweet almond oil, apricot oil, sorry, for those who have rosacea. And therefore, like, here's an example. I use a brand called doTERRA. A lot of you are familiar with it. And then there are also your other clean products in your local, like, health food store, not Whole Foods, but like your mom and pop health spot. You know, they got like burdock root. Not everybody carries burdock root. They carry burdock root. It's most likely a good spot. But you want to also investigate where the product comes from, because if they organic, you want to know what do they mean by organic. Don't want cross-contaminate. So for an example, a solution that I would make for like an energy, get my mind going, to just spark me up and give me some grounding and focus, I would use like wild orange, bergamot, peppermint, frankincense, clary sage, lavender, cedar wood, geranium, and lanolin. Cedarwood soothes and grounds the mind and the body, supports vitality and relaxation, peace, and emotional overall wellness. Frankincense is like the thing. That's my thing. I love frankincense and lavender. I can be an overdoer of it. I call myself an oil hoe because I just am. My one drop is like, Ray, one drop. And I'm like, but why?
I was thinking more is better sometimes when they talk up to the oil. You know what I mean? Like a few drops for my big head. I feel like I need one.
Right, I need a few drops. Right.
Yeah.
And so like sometimes I'm known to put it in my lotion before I go to bed when I get out of the shower, unless you make a roll on, which I also have. But I use commonly before I go to bed would be lavender and frankincense. And not only would I have that as an oil, I will also use it as a tea. Because, you know, when we talk about hair growth and all these things, you have to remember that it starts with inside of you. So whatever you put on the outside, you want to also find a way to ingest it and have it come within, trying to work with what's going on inside of you. And remember, there is a science to it. Here's another one before we go, is tea and herbs. Dill fights sugar cravings. Fennel balances blood sugar and helps with cravings. Ginger supports normal cortisol levels, minimizes cravings, reduces inflammation, or a better absorption of vitamins and minerals. Also, if you are inclined and not too sensitive to citrus from time to time, a nice glass of cold water with a slice of lime or key lime is essential to electrolytes and utilizing yourself, especially if you are always on the go. Just put it in your water bottle. Have 2 water bottles. One with your oils. Like I have one for like right here. My 1 water bottle. I have like Island mints and like one of my doTERRA things for like vitamin C and all the things, and then I have one that's just by itself, and I might put lime or something in it throughout. The ginger supports the normal cortisol levels and minimizes cravings, reduces inflammation for a better absorption of vitamins and nutrients. As I said, it also goes well with turmeric. You can mix the ginger, turmeric, and citrus together, typically lemon, and if you add some black pepper to it for the absorption essence. There's a whole science to it. It matters. Grapefruit, I love grapefruit seed oil in my water. I also like wearing it. Yes, it's such a delight smell. It's very calming. It's soothing. It works for me. I also love cinnamon leaf, which I'm a big fan of mixing cinnamon leaf, rosemary, lemongrass, and lavender. I mean, when I walk out the house, people are just like, what is that? I'm like, it's this thing. Oh my God, it's me. Yes, I smell that.
Oh my
Yeah,
gosh.
I'm not making you one. Sorry, I'm too busy, but I'm the ingredient. But grapefruit detoxifies is and habits what I want to say. Grapefruit is a detoxifier. It inhabits water and water retention, minimizes brain binge eating. It helps you with binge. Minimizes cravings, helps resist sugar, and healthy metabolism, which is also key, especially if you're dealing with the ebbs and flow of all the things. Sometimes we retain more water,
Yeah.
sometimes we don't. I do retain a lot of water. I'm also a health fanatic, and I mean that in the most healthiest way. I have a regimen that I keep because I produce low serotonin. I know that about myself. I've not been diagnosed as having depression. To me, it's the serotonin and all the levels that are constantly like this. So I know through my history, as long as I'm working out, I am superhuman. I am all the things. I'm the ish, and I'm good. I'm not working out. I do see the drop.
Yeah.
A significant drop. Folding laundry becomes more than the usual. I don't want to, and and then I know my symptoms. My symptoms are just like things just start. Like I start and I start and I start, and I'm just like I don't want to do it. And then I'm just like, oh girl, here's my signs are right in front of me, and I'm very diligent about calling myself out. And I have to say, ego, have a seat, subconscious, sit the F down. Really don't understand what's going on with you right now. Obviously, you've got a lot going on, but I need you to tackle these things. I put on a timer, give myself a certain amount of time to get it done because I'm human and I want to do all the things you cannot. And it's okay to not do all the things.
You can't do all the things all the time.
It is
That's not a
impossible.
fallacy.
It
We're
is.
still striving for that. I understand.
Right.
It's a constant battle. So now I just pick 3 things. Just if you do 3 things today, that's an accomplishment.
Yes.
If you do more than 3, great. But 3 things, that's it.
Thank you. Yes.
Yeah.
And then also the word balance. I'm doing my best to remove the word balance in the essence of describing life. Like I believe like equilibrium. Yeah. Because if you take away like a weigh machine, whatever you call it, the weigher, and you're gonna put a heavy object, put stones, crystals, blocks of gold or whatever, and they are of equal balance, then you're gonna have balance. Life is not that way. Life is that whatever has your most attention is get it. And the essence of multitasking, we are amazing at multitasking.
Yeah.
But we do know that it is really a cipher. It's a cycle because not everything is going to get the same attention, and you're going to come back, and you're going to come back, and you're going to come back until this is done and that's done. This is done.
You have to be okay with that.
Yes, have to be okay with that, and be kind to yourself. Just be patient, kind to yourself. Understand that you're human, having a spiritual experience. It's not easy being you, and remember that we'll never know what it is to walk in somebody else's shoes. So have the compassion, patience, and leading in love. And for me, leading in love means that I'll never know what it is to be you, but I do know that I myself have to have healthy boundaries. Works for me, and that I can be empathetic and just wish you wellness and continue to be on the journey with you as much as I am willing to and as much as you're willing to, and that we are all just doing the best that we can with what we have. I believe in creating a tribe. Please create your tribe. Have the people that you trust the most, be able to confide in and respect each other's privacy. All I can say, because that is just so key. When my girlfriends talk to me, whenever they share something, it's between me and them, unless they're sharing with everybody and they're making it known that it's a shared piece of information, telling them about them. You give me the go ahead and you're like, yo, I'm just, this is not private, I'm not keeping this to myself, whatever, but I do honor the respect of not talking about each other's stuff. There's value in that. It does create a sense of peace and ease in your body, because that means that you're able to trust. And because trust is one of the first things that's broken in us at a very early age in life, it does affect us emotionally, chemically. And so as we're going through life and dealing with the menopause and just the ebbs and flows cycles of life, it is never ending for us females. We are extraordinary forces of life and energy. And I am happy to have had this energy exchange with you. Thank you for blessing me to be long-winded in this goodbye to you. Until the next time we meet.
Oh, you're so fun.
Yes.
Yes. And first time I've finished mine.
Yeah. And thank my sister here. Thank you so much
Thank you.
for
Thank you
being
for
my
making-
first of my first. I appreciate this. This is amazing.
Thank you. Thank you guys for having me.
Yes.
This was fun.
Yes. And I look forward to having more with you about health and wellness and all the things. And
Remember, I just want to add, there's a lot of things in my experience that women hesitate to talk to their physician and GYN provider about. I really feel like there's not much things that can surprise me in terms of what patients say. So I'm here to just strongly encourage you all to just bring up the issues that you feel like I don't want to talk about, especially things that you feel are intimate, because as OBGYNs, that's literally what we do. Like, we take care of women who have babies. How did it get there? I mean, it was through intimate things, you know what I mean? So try really hard to establish a trusting relationship with your provider so that you can feel comfortable talking to them about these intimate things, because there's a lot of information that's misinformation out there, information from our culture, from our family, that we're trying to sift through and see whether or not we believe it or not. But just talking to somebody who at least has the information will be very helpful to help you make really good decisions about how to proceed with what's going on with your body. And menopause is a big thing that we don't really talk about. The older women, they didn't talk to us about menopause,
right.
and so we're having to figure it out ourselves. So I'm going to encourage that.
She isn't. No need to be sorry ever, because you're feeding the knowledge and encouraging us to share those things, and it's very valuable. Because those moments you feel very vulnerable, fragile, you feel embarrassed. Don't be embarrassed. If you were living a ratchet whole life, then you were living a ratchet whole life. And
we want to know so we can figure it out.
Right. And if you were comfortable doing that and being that, then that's great for you if you're happy in doing that. But there's a wellness that comes along with taking care of that. And then if you have some personal things in your relationships, don't be afraid to talk about it. It just has to be spoken about so you can better take care of your vagina, your overall wellness, and all the things. Because we want her wet and popping. Wet and popping.
So I'm not going there. We're about to meet now.
All the way.
All the way.
Thank you so much, Soul Body Wellness. Love you all. Have a good day. Till the next time.
Cheers. The questions on there?